An irregular heartbeat, often called arrhythmia, is a condition where the heart does not beat in its usual, steady rhythm. For many seniors, hearing that their heartbeat is irregular can cause worry or confusion. What does it really mean for your health? Is it dangerous? And what can you do to take care of your heart if you've been told you have an arrhythmia? Understanding the basics can help you feel more in control, make wise decisions, and live a full, active life. To begin, let's talk about how the heart works. Your heart is a strong muscle, about the size of your fist, and it works like a pump. Inside, there are 4 chambers, 2 on the top, called atria, and 2 on the bottom, called ventricles. The heart's main job is to send blood, full of oxygen, out to your body so all your organs and cells stay alive and healthy. Each heartbeat is started by a tiny electrical signal that begins in the right atrium, in a spot called the sinoatrial node. This is your heart's natural pacemaker. The signal flows through the heart in a certain pattern, causing the muscles to squeeze in the right order and at the right time. When everything is working well, your heart beats steadily, usually between 60 and 100 times per minute when you're resting. But sometimes, that electrical system doesn't work perfectly. The signal might start in the wrong place, go too fast, too slow, or get interrupted. This can cause your heart to beat in an irregular way. You might feel like your heart is skipping a beat, fluttering, pounding, or racing. Or you might not notice anything at all. Arrhythmias come in many shapes and sizes. Some are harmless and may not even need treatment. Others can make you feel tired, dizzy, or short of breath. In rare cases, they can be serious and require medical attention. For older adults, it's especially important to recognize and understand these rhythms because the risk of arrhythmia goes up with age. Why does age make a difference? As we grow older, our hearts, like the rest of our bodies, go through changes. The electrical system of the heart can become less efficient. There may be scarring or other changes in the heart muscle caused by high blood pressure, heart disease, or simply the aging process itself. Blood vessels can stiffen, and heart valves may not work as well as they used to. All of these factors make arrhythmias more common in seniors. One of the most common types of irregular heartbeat in older adults is called atrial fibrillation, or AFib. In atrial fibrillation, the upper chambers of the heart, the atria, quiver or shake instead of beating smoothly. This can make the heart beat too quickly and out of sync. AFib can be occasional or persistent, and sometimes it comes and goes without warning. Why does AFib matter? One big reason is that it raises the risk of stroke. When the atria don't squeeze properly, blood can pool and form clots. If a clot travels to the brain, it can cause a stroke, which can be life-threatening or lead to lasting disability. That's why doctors take AFib and other arrhythmias seriously, especially in seniors. But AFib is not the only arrhythmia. There are others, like bradycardia, when the heart beats too slowly, tachycardia, when it beats too fast, and extra beats called premature contractions. Some arrhythmias can make you feel faint, dizzy, or very tired. Others might cause chest discomfort or trouble breathing. So, what causes arrhythmias in seniors? Sometimes there's an underlying heart problem, like coronary artery disease, heart valve disease, or heart failure. High blood pressure, diabetes, thyroid problems, and sleep apnea can also play a role. Certain medicines, especially those used to treat high blood pressure or mental health conditions, can affect the heart's rhythm. Even low levels of potassium or magnesium in your blood can contribute. It's also important to remember that lifestyle choices can affect your heart rhythm. Too much caffeine, alcohol, or smoking can raise your risk. Stress and anxiety sometimes trigger irregular beats, as can dehydration or intense physical activity. How do you know if you have an irregular heartbeat? Some people notice symptoms right away. You might feel your heart racing, fluttering, or skipping beats. Others describe a pounding feeling in their chest, feeling lightheaded, or even fainting. Some people feel very tired, short of breath, or have chest pain. But many seniors have no symptoms at all, and the irregularity is found by a doctor during a routine checkup or test. If you or someone you love experiences a sudden, strong, or unusual heartbeat, especially with chest pain, fainting, or shortness of breath, it's very important to seek medical attention right away. These could be signs of a serious heart problem. Doctors can find arrhythmias in several ways. Often, they use an electrocardiogram, or ECG, which is a painless test that records the electrical signals in your heart. Sometimes, you might need to wear a special monitor for a day or two to catch irregular rhythms that come and go. In some cases, blood tests, echocardiograms, or other scans help the doctor understand what's happening. If you are diagnosed with an arrhythmia, what happens next? The answer depends on the type, how it affects you, and your overall health. Many people live with mild arrhythmias and never need treatment. Others may need medication, a pacemaker, or a procedure to fix the heart's rhythm. Medications are common for treating arrhythmias. Some help slow down a fast heartbeat, while others help prevent dangerous rhythms or reduce the risk of stroke. Blood thinners, for example, are often prescribed for people with AFib to lower the chance of blood clots. Your doctor will help you understand the benefits and side effects of any medicine you take. For some seniors, a small device called a pacemaker is needed. A pacemaker is placed under the skin near your chest. It sends electrical signals to keep your heart beating at a steady rate. Pacemakers are especially helpful if your heart tends to beat too slowly. In certain cases, a procedure called ablation is used. This involves threading a thin tube into your heart through a blood vessel. The doctor uses heat or cold to destroy the tiny area, causing the abnormal rhythm. While this sounds serious, it is a common procedure and can be very effective for the right person. The good news is that many seniors with arrhythmias can continue to enjoy their usual activities. With good care, most people can walk, garden, travel, and spend time with loved ones just as they always have. Taking care of your heart and your overall health is the key. What can you do to protect your heart and manage an irregular heartbeat? Here are some simple, practical steps. First, keep your doctor informed. Go to regular checkups and let your healthcare team know about any new symptoms, like palpitations, dizziness, or fainting. Bring a list of your medications to every visit and let them know if you have any trouble taking them. Second, make healthy choices every day. Eat a balanced diet with lots of fruits, vegetables, whole grains, lean protein, and healthy fats. Limit salt, sugar, and processed foods. Try to drink enough water unless your doctor has given you special instructions about fluids. Third, move your body. Physical activity is good for your heart and helps control blood pressure, cholesterol, and weight. You don't need to run a marathon. Gentle activities like walking, stretching, or swimming can make a big difference. Ask your doctor what kinds of exercise are safe for you. Fourth, avoid tobacco and limit alcohol. Smoking and heavy drinking can trigger or worsen arrhythmias. If you smoke, ask for help to quit. If you drink alcohol, keep it to a minimum. No more than 1 drink per day for women and 2 for men. And sometimes less is better. Fifth, manage stress. Deep breathing, meditation, gentle yoga, or spending time with friends can help calm your mind and lower your heart's workload. If you feel anxious or depressed, don't hesitate to talk to someone. Your mental health matters too. Sixth, take your medications exactly as prescribed. Don't stop or change your medicine without talking to your doctor, even if you feel fine. Some heart medications need to be taken at the same time every day. Using a pillbox or reminder can help you keep track. Seventh, watch for warning signs. If you notice sudden changes, like chest pain, fainting, confusion, or severe shortness of breath, call for help right away. These can be signs of a heart attack or other emergency. Finally, stay connected with your community. Loneliness and isolation can make health problems worse, especially for seniors. Reach out to family, friends, or local senior groups. Sharing your experiences with others can lift your spirits and help you feel supported. Living with an irregular heartbeat can feel overwhelming at first. But with the right information and support, you can take charge of your health. Many people with arrhythmias live long, active, and happy lives. Remember, you're not alone. Millions of seniors around the world manage this condition every day. It's also important to understand that some arrhythmias are more dangerous than others. For example, Ventricular fibrillation, where the lower chambers quiver instead of pumping, is a medical emergency. But most arrhythmias in seniors, like occasional extra beats or mild AFib, are treatable and manageable. Your doctor will help you understand your specific situation. Family members and caregivers play a big role. If you're caring for a loved one with an irregular heartbeat, help them stick to their medication schedule and encourage healthy habits. Keep emergency numbers handy and know when to call for help. Technology can also help. Some smartwatches and home monitors can track your heart rate and alert you to changes. But remember, these are just tools. They don't replace the advice of your doctor. If you have questions or worries about your heart rhythm, don't be afraid to speak up. Good communication with your healthcare team is one of the best ways to stay safe and healthy. Because stroke is a major concern with some arrhythmias, especially AFib, it's important to know the signs. Remember the word FAST: face drooping, arm weakness, speech difficulty, time to call 911. If you notice these signs in yourself or someone else, act quickly. Early treatment can save lives and reduce disability. Besides stroke, untreated arrhythmias can sometimes lead to heart failure, where the heart can't pump enough blood to meet the body's needs. Symptoms of heart failure include swelling in the legs, shortness of breath, and trouble exercising. If you notice these symptoms, tell your doctor. You might wonder if there are things you should avoid if you have an irregular heartbeat. Some over-the-counter medicines, like decongestants for colds, can trigger arrhythmias. Always check with your doctor or pharmacist before starting new medications or supplements. Also, be cautious with energy drinks or herbal products. They can contain ingredients that affect your heart. In summary, an irregular heartbeat means your heart isn't beating in its usual steady rhythm. For seniors, this is common and usually manageable, but it does require attention. Regular checkups, healthy habits, and good communication with your healthcare team are the keys to living well. Don't let an arrhythmia make you afraid to enjoy life. With knowledge, support, and the right care, your heart can keep beating strong for years to come. Every day is a new chance to make healthy choices and embrace the things you love, whether that's gardening, spending time with grandchildren, or simply enjoying a sunny morning. Remember, your heart is remarkable. It has served you well for many years, and with care and attention, it can keep supporting you for many more. If you have concerns about your heartbeat, take the first step. Talk to your doctor, ask questions, and learn about your options. You're never too old to take charge of your health, and you're never alone in this journey. Together, let's cherish every heartbeat, stay informed, and live life to the fullest, one steady beat at a time.